Okay, here we have Rich, and about 14 months ago, he had some really bad knee arthritis, and we decided to do the laser stem cell signaling. He's had a few booster treatments along the way. The latest thing he added was called NED, which is like an anti-aging compound and accelerates healing. They say it kind of reverses or staves off aging too. And then, so Rich, now that we're 14 months later, how are the knees doing? How's your pickleball doing? What are people saying your mobility is like?
In pickleball, people are remarking how well I'm moving.
Okay.
And many of the people there have had knee replacements.
Yeah.
And so I feel really good. And I'm running now without pain or awkwardness.
Yeah.
In either of my knees. So
wow.
I'm happy about that.
All right. And how many games do you play each day?
Probably about 5 to 6.
Wow. And how many days a week?
About 2 days a week.
Wow.
And then I do a pickleball workout one other time.
Like against the wall and stuff? Yeah.
Yeah.
That's good.
So
how many percent of your knees feel better after that? So
I would say it's close to probably 97, 98%.
That's amazing.
So.
Let me see your mobility is like. When you get to the chair, go to the door. And I want you to mimic one of your pickleball drills, like cutting back and forth and showing your knee mobility. Yeah. Uh-huh. And how far can you squat down? Look at that, all the way down to get those low balls.
Yeah.
Yeah. And what are people saying you're noticing when you're on the court?
They notice how well I'm moving.
Yeah, that's great.
And how well I'm running. And,
yeah. And they're all knee replacements out slower.
And they're slower.
And you have the natural cells to grow your cartilage. Hey,
that's right.
I'll take it.
That's right.
All right, congratulations to the successful program, and we'll keep on monitoring your progress.
Okay.